Hello guys, so finally my video is going up. Instagram has been giving me so much trouble today, but so finally we do have a good new video. So in this video I'm going to be talking about what happens at the gynecologist's office. So the gynecologist office will not be a mystery anymore, hopefully. I'm going to tell you basically how they do the examination, what the little instrument they put in. I'm going to demonstrate how it goes in, what the gynecologist sees in that, and I'm going to give you an additional note on something called a pap smear. I'm sure you must have heard of it, and in this you understand how a pap smear works. So let me just get in with the model and explain everything. Right, so let me give you a quick demonstration of what the female anatomy looks like. If you've seen my previous video, you'll have seen that I've explained what the labia are, what the clitoris is, what the urethra is, what the vagina is, what the vulva is, all of that. I'll give you a quick brief overview just, so that it helps. This is the labia majora, the outer big lips that we mentioned before. This is the labia minora, the small lips. That is the urethra, that's where your pee comes out from. This is the vagina, the separate hole, that's where you give birth from, that's where you have sex from. That's where your menstrual cup goes in. This here is the clitoris right here. There's something covering it called the clitoral hood. So just wanted to explain what basically happens in the gynecologist's office. There's going to be a cute little instrument you see there. It might not sound so cute really, but it's this instrument right here. It's called a speculum. I like to think it looks like a duck beak, whack whack. Sorry, that was quite terrible. But yeah, so there's this speculum. This essentially goes inside and it opens up. So I'll uncoil this. Am I uncoiling it? Whatever. So it opens up and then it can spread apart the walls of your vagina so you can see better. I'll give you a quick demonstration to tell you what exactly happens in there. Cool. So this is the speculum. So what I'm going to do is we spread apart the lips, we have the speculum closed and it's covered with jelly, so there's a lubricant that will keep this wet. We put this in like this and we rotate it and we whoop. So I'm gonna fix this so we can see better. Cool. So I've put the speculum inside. I have spread it apart so the walls of the vagina have gone apart, and you see that little dot inside? That's the cervix. Cool. Trying really hard to focus here, guys, sorry. You see that little dot? That's the cervix. Beyond the cervix is your uterus. That's where the babies are stored, like the little jam factory. Oh, there it is. That's a perfect view. On the bottom you can see vagina, and that's it essentially. Yeah, now you know what happens at the gyno's office. When we do a pap smear, if you've heard of that, what they do is hang on, this is going to be a bit tricky, but I will try. Yes, we can do this. So they take a brush like this, they go to your cervix. This is not painful at all, and then they kind of brush it over there. They get some cells from the top of your cervix, and then the cells are sent for examination, and that's what a pap smear is. So 2 videos in one, guys. Woohoo! Alright guys, I hope that made sense. So like I said, you put the speculum in, you expand it so that puts the walls of the vagina apart, and then you can actually have a look inside. So in there we look at the walls of the vagina. We see if there's any injuries, any lacerations on the walls of the vagina. Then we take a look at the cervix. We see if the cervix is healthy or not, and if it looks unhealthy, we might go for a pap smear in that case as well. What a pap smear essentially is that it's a screening tool for something called cervical cancer. Cervical cancer is one of the most common cancers that happens in India. It's more common in the rural population, and I realize we hear a lot about breast cancer, but we do not hear enough about cervical cancer. The cool thing about cervical cancer is that it has a vaccine to prevent cervical. I mean, there's a vaccine available to prevent cervical cancer. We can all get it, you know, especially women who are sexually active. So I'm going to be doing another video on cervical cancer and the cervical cancer vaccine in general, as this has been a follower request. But in addition to that, you know, I think this gives you a nice brief overview of how to test for cervical cancer. So right now I'm living in the UK, and over here the National Health Services, or the NHS, this is the local hospital system here, they recommend doing a they recommend doing a pap smear every 3 years for women between the ages of 25 to 49. In India, we don't really have any such guidelines that strictly recommend this. Of course, you know, they recommend getting pap smears done as frequently as possible, but we don't have like a nationalized system for this, unfortunately. But lots of countries have these, and they seem to work very, very well, because if diagnosed early, cervical cancers are highly treatable. But if diagnosed late, you know, they come with their own set of problems. But essentially, this is the idea behind the video. So I hope this clears out what happens at the gynecologist's office for you. And also, in addition, you know, there's a little bonus, and it tells you what happens in a pap smear. I hope this helps people, and you know, I'm really sorry about this entire clusterfuck of not being able to upload anything. I was moving between the UK and India, and I finally settled in now, so I finally can put out videos properly again. After this, early next week, I am doing the contraceptive video, so we have that coming up. And that's it. If there's any more requests, any more questions, please feel free to drop me a message. I would be happy to answer your questions, and maybe if needed, do a video on them. Have a lovely week, you guys, and keep dispelling sex ed myths. Woohoo!